大家好，听得到我们吗？
可以，谢谢。
谢谢。刚刚我们有一点技术问题哈，因为医院的网络防火墙有一点问题。Sorry about that. We welcome everybody. Tonight is our breast cancer awareness month, and next to me is Dr. Lin. Dr. Lin is our special guest for our Chinese medical program. 我简单先介绍一下哈，坐在我旁边的呢是林医生。刚刚我们大家有一点技术上的问题哈，那我们现在开始讲座。我先简单介绍一下我们的program， 然后呢我们会介绍我们的 speaker， 就开始我们今晚上的讲座。我简单说一下，我们今天晚上的讲座呢会录影，如果您不希望您的脸被录到，或者说您希望把你的 camera 关起来呢，那你就不要打开哈。那后面的话呢，我们也有提问的时间。所以呢，在讲座的中途，如果有什么问题，你们可以简短的提问，或者是把你们的问题放在 chat box 里面。我是 Stephanie 哈，我是Chinese Medical Program 的Regional Director， 是我的荣幸，常常能有机会跟大家来沟通，然后跟林医生一起举办了很多网络的讲座。从 pandemic 到现在呢，我们差不多已经进行了9场，将近这是第10场线上的讲座。那我们今天呢带来的是Breast Cancer Awareness Month 的一个 webinar， 是由我们的Breast Cancer surgeon 是专门的一个乳房手术科医生和一个 medical oncologist 是一个肿瘤科和血液科的专家，今天晚上给我们带来讲座哈。那我们的林医生呢一如既往给我们提供实时的翻译，然后呢也给我们大家后面有 Q&A 的时候呢主持更多方面问题。那我先简单介绍一下我们的 program 哈。所以我们华人医疗服务部呢 Chinese Medical Program actually so we started from 2010 as like 12 years we serve the community already, and Chinese Medical Program has also expanded to Hamilton and Somerset in 2018. 所以我们华人医疗服务部呢是在2010年就开始为大家服务了。从2018年的时候呢，我们也在Somerset 和Hamilton 2个地方成立了新的分支。非常高兴的是，就是right after pandemic， 我们在2021年的3月份，在我们的New Brunswick 华人的聚居中心开设了我们另外一家第5个 location。 那你们可以从屏幕上看到说，我们2010年的10月还有16年8月我们还开了美门分院、南部分院，然后现在呢有5个 location 都可以为大家服务。那Barnabas House 呢在整个 New Jersey 是一个最大的医疗保健系统。那我们的旗下现在其实已经有13家医院了，还有4家儿童医院，还有康复运动中心、影像中心，还有很多不同的其他保健设施，不仅仅是 hospital 哈，那有很多你们熟知的，像有一些 University Radiology 的几个分部，还有包括 Rutgers House， 还有Cancer CINJ 大家都很熟悉了。那所有的这些呢，都是为大家我们华人的全 New Jersey 的医疗健康服务的。那华人这部分呢，我们也都带去看各种各样的医生，包括说美国人的医生呢，我们都会带去帮他们做一站式的服务。对，大家可以看到说我们的这个服务呢，实际上是从我们的病人打第1个电话的那一天起，有很多人跟我们已经超过10年以上了。那这10年当中，我们就是带他们去各种各样的医生，从家庭科医生起步，然后呢各种各样的测试。请我的同事帮忙 mute 一下其他的没有关掉麦克风的观众好吗？那我简单介绍一下我们的服务哈。其实呢，大家可以看到我们各种各样的专科服务有很多，包括骨科呀、妇产科、儿科、心肺科，包括肠胃科、老年科，这些都有。那有一些呢，我常常要提的一点就是说，我们不是一个 third party 哈，我们都是医院的 employee。那我们所有的东西呢，都是走大家的保险，那没有任何的收费，这是常常大家有疑问的一个地方。另外的话呢，我们是真的是从 first step to the last step， 一直 accompany patient 帮忙填表，帮忙就是翻译，然后包括 follow up 的 appointment，还有其他各种各样的他们需要的服务，包括交通哈，那都是根据大家的需要来提供服务的。那我简单介绍一下我们的团队。那前面已经提到，我们现在有5个 location 哈，那可以看得到我前面这3位哈。我是 Stephanie， 我还有2个同事 Josephine 和 Vivian， 他们是在美门医院。从现在开始呢，Vivian卜小薇小姐她现在也去 Hamilton。那Angela 和Cassie 呢是我的同事，我想让他们也来介绍一下New Brunswick 这边。然后你们可以看到总案哈，陈清霞是在Somerset。那我请 Angela 先介绍一下 New Brunswick 这边。
大家好哈，我是李安琪。刚才呢 Stephanie 已经告诉了大家，就是关于我们华人医疗服务部哈整个团队。我就是跟 Kathy， 我在 New Brunswick 这里，我也很开心哈。Kathy 呢就是她在我旁边哈。从9月份开始呢，我跟Kathy 呢，然后 Stephanie， 我们3个就在 New Brunswick 这里呢服务大家。希望大家能够呢利用我们的服务哈，因为每一个病人呢对我们来讲哈，就是我们都是很用心来到帮助大家。然后我们电话也是在这个 flyer 上面哈，如果有什么问题的话，大家可以打电话来。Kathy 你也该。
谢谢大家很高兴可以 join Angela 在我们 New Brunswick 那边。那我就是在这里呢，如果大家有什么可以为你们服务的，随时给我电话。我的名字就是 Kathy， 中文是简洁怡。谢谢，
谢谢大家。好我们今天的讲座正式的开始哈，我们想请林医生来到介绍大家哈。OK， 好。
不好意思哈，今天呢，我们另外的几个电脑都被医院的防火墙给拦住了。这个 firewall we cannot use like 3 computer at the same time, so we kind of like take seat one by one. So I want to introduce our special speaker for tonight. So the first one is our breast surgeon, Dr. Coley. And you know what? Dr. Coley seeing so many of Chinese medical programs of patients, and she's also taking care of our Russian patients. And I have to say, she actually I really appreciate it because it's October is a breast cancer awareness month, and she take us in the last minute， 在最后1分钟哈，他呢跟我们说 OK， 我可以帮忙你们来做这个乳房讲座。那 breast cancer month she is so busy， and 我的同事们，你们可不可以帮忙我 mute 一下其他的观众哈 ？So she also is the first one in New Jersey doing special surgery。 他呢在新泽西是第1个开始给一些像小细胞癌和导管癌像这种哈，他是第1位在 New Jersey 开始做这样的手术的，所以呢可以 avoid 一些necessary 的一些手术，一些就是 open 的那些手术就可以用不用手术的方法，用一些先进的医疗方法来给大家做手术。那这个是非常非常特别的，在 New Jersey 和 Mama's Medical Center 都是 #1 哈。OK， 我们还有 another special speaker today is Dr. Patrick Lee. Dr. Patrick Lee 是我们的hematology and oncology medical doctor oncologist. He's very special too because he actually seeing a lot of patient and in at least 3 locations. And Dr. Coley is also seeing our patient in 3 different locations. And also for Dr. Lee, he will give us like a most updated information for the cancer field tonight. And there's some special thing he will talk later, so don't leave, okay? And last but the least, 我们的 Dr. Lin， 我们的李医生，大家都很熟悉他哈。那他呢是在Robert Johnson Medical School 的faculty。那这么长时间以来哈，他真的是就举个例子，星期天的晚上，他连着参加了2个活动，那帮我们有做 screening， 然后有做 做我们一个 physician event 的keynote speaker， 那真的是帮了我们很多忙，也把我们 connect 到不同的部门、不同的医生，尤其在这个 community 里面呢，他也做了大量的工作，他也是Rutgers 的环球医疗副院长，另外还是健康家庭多元文化的主任。所以呢，下面这段时间呢，我们就交给林医生和 Dr. Coley 和 Dr. Lee， 然后大家可以来提问题在讲座之后，好吗？Dr. Coley, you can start and give us 1 second to launch the new slides. Okay.
I can see it, yeah?
Yeah.
Thank you, everyone. Sorry about that. Thanks for your patience. So, a background on breast cancer. Breast cancer is the most common site of cancer in women. 30% of all cancers in women are breast in origin. In the United States, 1 in 8 women will develop breast cancer in their lifetime, which is about 12.8% average risk. There will be 287,850 new cases of breast cancer in 2022 alone, and it's the second most common cause of cancer death in women. It's the leading cause of death in women age 40 to 55.
所以刚才呢，我们也希望说用中文的 slide 让各位知道，就是说这个8个女人里面，大概有1个人在美国呢就会患这个乳腺癌。那么2022年呢，统计将会有287850个新的病例，这个是女性的癌症死亡第2大原因。
Thank you. So, the incidence of breast cancer is displayed in this slide. The incidence rates have been increasing about 0.5% per year since the mid-2000s. And that's likely due to declines in fertility and increases in excess body weight.
所以从2000年开始呢，每一年几乎这个发病率是增加 0.5%， 这可能是由于这个生育的能力继续下降，然后体重过重。因为体重过重的时候呢，就有一种女性荷尔蒙会增加，那会增加这个乳癌的可能性。
The survival rates are displayed here. So, at the diagnosis time, one of the most important factors affecting the prognosis is the stage. If disease is localized, meaning it is within the breast, it has a 99% survival rate. If it's regional, meaning breast and regional lymph nodes, it has an 86% 5-year relative survival rate. And if metastatic, about 27%. However, this doesn't account for these tumor types and the behavior of each different type of breast cancer. So if we see that it is a hormone positive breast cancer without HER2/neu positivity, it has a 92% survival rate. And you can see the different survival rates based on the receptor status, which are basically the things that are present on the cancer cell that are leading to growth of the cancer and the stimulation of the cancer cells. So patients who are diagnosed at stage 1 across all the different types, however, were found to have a 95% or greater survival rate.
所以这个乳癌呢，就是在发现的时候是哪一期的是最重要的。如果发现的时候是第1期的话，那么5年的生存率呢是95%以上。
如果说发现的时候是只有局部的疾病，意思就是说并没有转移到淋巴结的话，那么是大概99%。那如果说是有转移到这个局部的淋巴癌的话，所以可以是86%。如果说诊断转移到别的地方的淋巴的话，那么5年的存活率是27%。那么除了这个是发现的时候是哪一期之外，还有一些很重要的事情，因为人体的女性呢有2种不同的荷尔蒙，那么这个荷尔蒙如果有这个肿瘤的种类的话，这边有列出一些有的是从92%到77%，是根据它的它的不同的肿瘤而有变化。
The goals of a comprehensive breast cancer program are that we want to screen patients and basically look for disease in patients who have no symptoms, which will help reduce the death rate associated with cancer. So with the improved imaging modalities that we have, we're able to diagnose cancers earlier, and a smaller tumor at the time of identification means it's an earlier stage and better prognosis. There's now a high percentage of patients who are being found to have a non-invasive or stage 0 breast cancer, or very small, less than 1 centimeter cancer when it's diagnosed with screening imaging, rather than waiting for the patient to feel a lump. And these improved survival rates mean that we can focus also not on just what the diagnosis is in the moment, but think of the long-term implications for the patient. Think of quality of their care and quality of life. So 3.8 million women in the US have survived a breast cancer diagnosis. It's the single biggest group and largest growing group of survivors in the United States. And now we even have started shifting towards trying to prevent cancers and identifying those who are at the highest risk. And that can be done by assessing several things, not just family history, but personal characteristics.
所以我们综合的计划的目标呢，就是要能够早期的筛检、早期的诊断，然后存活率就会更高。那在现在比起10年前呢，我们所做的乳房 X 光的检查呢是非常精细的，即使是小于1厘米的癌症都可以找出来，所以能够更早的检查呢，就意味着存活率会更高。那么美国呢是有380万的女性在诊断患有乳癌以后可以幸存下来，这是在所有的癌症里面存活率最高的。同时我们现在也有一些方法可以来分辨，除了说是有家族史以外，可以识别说有哪些人是高危险群。
So this is just an example of the many details that come into play when discussing a patient's breast cancer diagnosis with them at the time of their initial visit. It can be overwhelming for patients because there are so many details and it's hard to know what is most important. So this is something I give to patients to try and make it as easy as possible to understand what the diagnosis is, where it is, the behavior of it, and then what the plan might be, not just with surgery, but the treatments that we do either before or after surgery, and some additional considerations. So, hopefully the patient leaves after that initial visit with at least an improved understanding of what the plan is, short-term and long-term.
所以这一章呢，就是跟各位讲一下，就是第一次当病人诊断出来有乳癌的时候，要有怎么样的一个讨论。通常呢会癌症科的医生会跟病人还有家属讨论说，手术前可以做什么样的治疗，手术后做什么样的治疗，然后手术又有各种不一样的。当然在第一次见面的时候，这听起来会好像哇太多了，没有办法吸收，但是呢就希望说能够慢慢的给病人了解。那么 Dr. Coley 他通常会给这一个表格，让病人及家属可以拿回家慢慢看。
So there have been a lot of advances in the management of breast cancer from a surgical standpoint. If you go back to the 1960s, breast cancer was treated with very aggressive surgery known as a radical mastectomy, which removed the entire breast, the muscle underneath, all of the lymph nodes under the arm, and it was a very disfiguring surgery. And it really didn't have an improved survival rate, even though it was highly aggressive. So over time, we started to modify the surgery without having to take as much skin. And that was then called a modified radical mastectomy. So at least there was some closure over the chest wall.
所以即使是这乳癌的手术，从1960年以来也改善很多。在以前呢，多半就是把整个乳房拿掉，但是现在渐渐的是有这种乳房全手术的，包括对皮肤、乳房、胸肌及腋下的组织有深度的解剖。所以就是说在以前呢，虽然整个都除掉，但是并没有提高它的生存率。那现在有很多的改变，用不同的方法也可以保存它的皮肤，保存它的胸肌及保存腋下的组织。
There was a great trial called NSABP04, which reduced the side effects of breast cancer surgery, but still was able to provide good control of cancer. So this project proved that there was not a significant improvement in the patient's survival rate when they had that very aggressive radical mastectomy compared to less extensive surgery. We also found that in patients who did not have lymph node involvement, that removing all of the lymph nodes under the arm was overly aggressive. So we were then able to transition to removing fewer lymph nodes. This is important because removing lymph nodes can also cause swelling of the arm, as those lymph nodes don't only drain the breast, they drain the extremity. And if it's not going to improve the patient's overall survival rate, and it's only going to cause long-term issues like disability, swelling of the arm, infections, we're able to de-escalate what we do to those lymph nodes. But in addition, we saw that there really wasn't a great improvement in the survival rate of patients who did a mastectomy versus just a lumpectomy, which is removing the tumor itself, but keeping the rest of the breast, which is unaffected. The main difference was that the patients who had a lumpectomy had a higher chance of it coming back locally in the breast, but that's mitigated by doing radiation after lumpectomy. So now it's possible to offer patients either option, knowing that the overall survival rate is the same if the patient's getting a lumpectomy followed by radiation versus a mastectomy and complete removal of the breast. So the bigger surgery doesn't necessarily mean a better survival rate.
Dr. Coley 提到这个研究， 就是说大家发现说这么多年来，如果把整个乳房切除的话，并没有增加存活率。倒是用另外一种，就是只切除这个肿瘤，然后再加上放射线的治疗，这两个加起来 lumpectomy 就是切除肿瘤，然后 radiation 这两个加起来，它的效果跟把整个乳房切除的效果是差不多的，存活率是差不多的。
This is another example of how surgery has changed over time. And you can really see that since the 1960s, 1970s, we really have worked hard to reduce the aggressiveness and the magnitude of the surgery that we're doing on the patient while still providing an excellent outcome. So each day, each year, we're trying to push further to do better for our patients.
这张图就是跟各位看，从1971年到2001年，每隔几年就有一个比较研究更新的方法出来，然后能够把这个乳房的组织可以保存更多，然后有减少这个副作用。譬如说，像在以前1960年的时候，除了切除整个乳房，还把腋下所有的淋巴结都切除，结果有很多人会变成这个腋下的会有水肿，所以现在的这些方法呢，比较不会造成这些副作用。
Breast conserving surgery is with the goal of avoiding mastectomy. And we have three primary aims. We want to make sure that we're removing a cancerous tumor with clear margins, meaning a rim of healthy tissue around it. We want to do it while still achieving a good cosmetic outcome, because you ultimately want to save the breast. And if you're removing a large portion of the breast to the point where it doesn't resemble a natural breast, that's not ideal. And we want to do this while providing, at the very least, equivalent survival to a traditional mastectomy. But it's important to know that we can't offer this to every patient. We have to be careful and ensure that the patient does not have multi-centric disease. This means that there are different tumors in different parts of the breast, different quadrants, and removing them with lumpectomies would mean removing most of the breast. We want to make sure that we're not removing a larger amount of breast than what we're leaving behind. And we need to make sure that these patients don't have a history of radiation that would contraindicate that plan. Or if we can't clear the margins despite multiple attempts. And unfortunately, we can't offer this surgery in patients who are pregnant. It's rare to diagnose a patient in pregnancy, but it does happen. And those patients really aren't candidates for radiation therapy and therefore need to have mastectomy.
所以现在比较多人做的这个叫做乳房保留手术，就是不是把整个乳房切除，它是保留。最重要是要有3个目的。就是说，一方面是切除的时候，这个肿瘤的周围已经都没有肿瘤细胞了，然后能够达到良好的美容效果，然后至少提供跟传统的全乳切除手术有相当的存活率，但是也并不是每一个病人都合适做这个。因为有一些方法，譬如说，如果有一个人他的乳房有超过2种以上不同种的肿瘤的话，那么不切除大部分的乳房就没有办法切除这些肿瘤，或者是说在一个乳房来讲，超过50%都是肿瘤细胞，而健康细胞少于50%的话，那么做这种手术也没有什么效果。那么另外还有一个就是说，如果 胸部的放射治疗以前曾经做过的话，那么就现在不能再做，因为这个会对胸壁的总辐射量会过高。另外呢，还有如果是怀孕的病人的话，通常这种乳房保留手术是切除小部分切除了肿瘤，然后还要加上放射线治疗。但是一个怀孕的孕妇的话是不合适做放射线治疗，会对胎儿造成影响，所以也不适合做这个手术。
So now there are many ways to treat breast cancer with options which shift the focus towards excellent long-term outcomes, while not only being oncologic or cancer-related outcomes, but provide a more natural appearance to the breast, which is a surrogate for their quality of life. So the way that we're able to maintain that natural appearance is sometimes we do mastectomy, where we save all of the skin, the nipple, everything on the outside, and hide the scar underneath the breast with a hidden scar approach. We also can do lumpectomies, where we make sure there's no indentation or change in the shape of the breast by doing oncoplasty, or moving the patient's normal healthy tissue around to fill that cavity. And there are several options for breast reconstruction, which is done with a plastic surgeon. So the photo here is a picture of a patient who had mastectomy and reconstruction. And you can see the difference from how it was done decades ago it's vastly different. The patient is not somebody you can identify as having had mastectomy in their clothes, and the goal is also out of their clothes. They want to feel comfortable and look like themselves when they look in the mirror.
所以这边的相片呢，是给各位看一下，就是现在的手术的方法不太一样了。在上面那里你可以看到有一个疤痕比较可以看得出来，然后呢，这个切除了以后呢，一边的乳房会比另外一边小，但是呢，为了要维持这个女士的生活的品质，现在的手术呢是尽量的保留她的皮肤，保留她的乳头保持自然的外观，然后尽量的隐藏这个疤痕，同时呢，也可以整形式的乳癌切除手术。然后也可以有乳房再造，所以现在呢，有很多的病人在动手术之前就已经跟医生讨论过，当把这个大部分的肿瘤切除出来以后，在同样的时间也植入乳房再造的手术。
As I mentioned before, we try to minimize the number of lymph nodes removed so that we can prevent lymphedema or swelling of the arm. So not only do we try to reduce the number of lymph nodes we remove, but we have new technology that allows us to monitor the patients so that we can hopefully detect swelling of the arm before they have noticeable swelling. And this is a picture of my patient getting a measurement with the machine, which will be able to detect as little as 2 tablespoons of fluid in the arm, and they can't yet feel of the arm, they can't tell that their jewelry is tight, and it allows us to intervene early with compression garments and physical therapy to reverse that.
I'm sorry, Dr. Coley, we're asking people to mute audience microphone.
No problem.
所以这边呢是他的病人，他在就是说我们现在不只是减少切除淋巴结的数量，同时呢也用新的技术来监测所有的异体的患者，通过服装或者是物理治疗的方法来进行早期的干预，而使得不会肿胀起来。
So in summary, from my standpoint, we have the latest advances in breast imaging, surgical options, radiation, and medical oncology interventions, which Dr. Lee will speak about in more detail. Our patients are living longer lives and they're living healthier lives. And none of this would be possible if patients don't get their cancer screenings and maintain awareness of their body. So showing up is the most important thing. Going for the mammogram annually and making note of any changes that are different from what's normal for you. So, you know, as a side note, we did notice that many patients were not on track with getting their routine imaging during the pandemic. And it's unfortunate that we then have seen a lot of more advanced breast cancers with patients who, you know, come in after feeling a lump, and that might have been picked up much earlier at an earlier stage if they had a routine screening mammogram and hopefully with less aggressive treatments. So it really is very important to maintain that breast cancer screening. At least, you know, it should be once a year. And I saw that there was a question about, you know, when do we stop getting mammogram? That's a bit controversial, but the goal is that you continue getting the imaging as long as we would act upon the results. And there are so many different ways to treat breast cancer that, you know, we used to say if a patient isn't very healthy, they're in a nursing home, they have a lot of other medical problems that we really don't want to, you know, subject them to the imaging. However, sometimes we can still treat them in non-surgical ways. So it's really a matter of, would we be willing and able to treat the patient if they were getting imaging and we found something abnormal?
所以 Dr. Coley 呢，就是提醒各位，尤其是现在在新疫病情过去的2年半呢，不仅是肿瘤科的医生，我们家庭医师也发现有很多的病人，他们都不再去做这个定时的乳房筛检，所以呢，现在的人他们如果发现的硬块，通常呢都已经是超过第1期了，所以要跟各位提醒，要继续要做这个乳房的 X 光筛检，1年1次。那么有人问说，那要做到几岁呢？据 Dr. Coley 的说法，就是说，只要你有发现什么样不正常的地方，需要继续的做的话，那么就要继续进行。那在以前呢，曾经有人说，哦，如果有一个人他已经是住在养老院啦，或者他有很多的慢性病啦，也许不需要再去做乳房的这个 X 光筛检，但是现在的想法又不一样了。即使是他们在养老院，即使是他们有很多慢性的病，但是还是有一些方法可以来让他们余生过得比较好一点，并不见得说每一个人都需要动手术，还是要做这个化疗。所以就提醒各位，如果说您在过去的12个月里面还没有做过乳房的筛检的话，请跟你们的医生提起，然后都去做。
Thank you for having me.
谢谢。
非常感谢 Dr. Coley 哈。那因为这里面有很多 detail 的 information， 那我们在过去的几期的我们华人医疗服务部呢，在报纸上有一个健康专栏。那这个健康专栏上呢，我们有介绍过 Dr. Coley 和他最新的这种手术，就是包括说不用做surgery 就可以就做就是小细胞的和一些简单的那些手术。那在 newspaper 上呢，我们都有publish 出来，到时候也都可以分享给大家。那我们现在呢，过一会儿就请Dr. Lee 来为我们做oncology 这个癌症方面的这个介绍哈。那我们现在可以把那个 李医生的那个癌症方面的PDF 打开就可以了。我就简单再说一下哈，我们华人医疗服务部呢，在Global Times 上像有一个专栏，那个上面呢是有具体的一些介绍，我们都可以说。我看到Pauline 好像有个 question， 是不是？Pauline 你可以自己 unmute， 然后先问一下问题好吗？您是我们留言区里也有问题哈，您先开 PDF， 我来。
好的，我先问一个问题啊，就是现在呢，你们说的是1年1次作为就是 regular 的这个 mammogram check，但是我现在听到的一个问题呢，就是有过病史的是吧？是 lumpectomy， DCRS， 那就是这几年一直是在做的，坚持做的，但是就是有一个情况呢，就是说今年比如说我7月份我刚做过，他说没问题，但是我就过了那个时间，现在就觉得很不舒服，很有觉得疼啊、胀啊，像这种情况，是不是还要再去做检查？
如果你即使是做过了，然后现在不舒服的话，那就建议您还是去找你的医生。OK， 不管你是肿瘤科的医生或者是家庭医师，这个因为你现在的肿胀倒不一定是肿瘤，但是也需要查出来到底是什么问题，所以希望你就赶快跟您的医生联络。
好的，谢谢。
Yeah, Dr. Pauline and Dr. Lee, there's some questions actually. Before we open the PDF file for Dr. Lee, we can answer some of them. The patient actually is just asking like she did surgery before. She also keep like a monitor every single year, but sometimes she feel like she's not very comfortable. Does she need to go back to the breast surgeon and the medical oncologist?
She's not very comfortable. Could you elaborate?
So, so she says she just had the mammogram done in July, but now in October, she feels some discomfort in her breast and feel a little bit swollen. So she was asking, should she wait until next year or should she go now?
Absolutely should be checked out if there's any new symptoms. Whether it's pain or swelling, she should absolutely return to her surgeon or at the very least get a prescription from her doctor to go for repeat imaging, diagnostic imaging, so they can ensure that there's nothing concerning going on that's leading to those new symptoms. You know, breast pain is not uncommon. And it doesn't always mean that there's a cancer there, but with a history of cancer, she really should be checking it out to make sure.
Yes， 所以呢 ，Dr. Coley 也是这么说，就是说，既然有这个历史，所以如果你觉得不舒服的话，那么应该就赶快去跟你的医生讨论。
Okay, thank you. Yeah, because this is uncomfortable is never even previously, get cancer. It's no such a symptom. Right now, it's really bother. So thank you for advice.
Of course.
Hi, Dr. Colleen, I have one question. I go to, can you hear me okay?
I can, yeah.
Yeah. I go to a mammogram every year. I was told I have a dense tissue on my left breast. So the doctor always asked me to do the ultrasound as well. In my case, is there anything I need to be aware or do I need to go more frequent?
So there are 4 different categories of breast density. And if you're in the 2 higher categories, we advise getting supplemental imaging because mammograms sometimes can't see through that dense tissue as well.
Mm-hmm.
And the supplemental imaging options are ultrasound or MRI. So if you're in the 3rd category, where it's called heterogeneously dense, then we say ultrasound of both breasts, whole breasts, is advised at the time of the mammogram every year. If you're in the highest category, extremely dense, then MRI is a consideration. And New Jersey has a breast density law that requires that the radiologist discloses what the breast density category is and that insurance companies cover that additional imaging. And it is very important because not only can the dense breast tissue hide things on the imaging, but it's an independent risk factor. And having extremely dense breast tissue can increase the risk of breast cancer.
I see. So I should go definitely annually for sure. But I'm doing
annually for sure, and with that additional imaging. And as far as annually versus more frequently, we try to assess the patient's risk. If they have a higher risk of getting breast cancer than the average person, if they're above 20%, then we say, yes, you should do mammograms and MRIs and actually space the studies out. So you're doing one study now and then the other study in 6 months. So you're not going a whole year without looking. And you're
how do you assess the how do you assess your above the average?
So your OBGYN should be able to calculate the risk. Or when you get your breast imaging, a lot of the breast centers ask several questions that will calculate the risk. So not only family history, but hormonal aspects, biopsies in the past, height, weight, and breast density, all of those come into play. So
okay, all right. Thank you. Yeah, I do have a mammogram and also ultrasound every year.
Great.
Yeah. Thank you.
All right， 所以刚才所讲的就是说，有人如果说每次报告说你的这个乳房的组织非常的密，然后看不太清楚的话，要怎么做？那么，Dr. Coley 的解释就是说，通常我们可以分成4个种类。那如果是第1、第2种的话，那么可以说多加一个做超音波 ultrasound 或者是 MRI。如果是第3、第4类的话，是更密布的话，那么就需要说这个可能需要每6个月一次做 mammogram， 一次做 MRI。所以如果您的医生，妇产科医生或者是放射线科医生，通常呢这个报告出来的时候，他们都会已经算好，就是说危险性是怎么样。我们现在是7点54分，所以我想我们是先请李医师
开始讲好不好？我们之后还有Q&A 的提问时间哈。李医生，请您开始。
Dr. Lee, please start to give the lecture. Thank you.
Okay, sure. I just first want to start off with just thanking everyone for signing in. It's always a pleasure to be able to have people interested in what I have to say. Thank you, Dr. Coley, for joining me, for joining us, and thank you, Stephanie, and everyone who helped put this together. For the next few minutes, I just want to just present an overview just of just kind of my aspect of the treatment for breast cancer. Dr. Coley has already gone over, the incidence of and mortality of breast cancer, but breast cancer is very common. Most common cancer in women, and obviously a very prevalent cancer in in America and obviously my medical practice as well.
所以刚才 Dr. Coley 有提到，就是我们知道发病率跟死亡率，那么这个每一年呢，美国大概至少有26万以上的人呢有新病例，然后每一年呢至少有4万人死亡。
So mortality rates for breast cancer have been declining since the 1970s, and we believe that's mainly from two factors. One, increased breast cancer screening, and improve treatments for breast cancer.
从1970年以来，这个死亡率渐渐的下降，所以我们知道说，主要的是 增加了乳房的筛检，同时呢也有更好的治疗方法，因此呢减少了死亡率。
Oh, we can go back to the slide right before this. So to illustrate the benefit of mammograms, this is just an observational study from a county in Sweden where they looked at the participation in mammograms before 1970 and after 1970. And what you see here is, after 1970, before 1970, there was very little participation in mammograms. And then after 1970, a greater proportion of the population began to have their mammograms.
所以这个图片你可以看到，左边呢是蓝色的，右边是绿色的。蓝色的呢，就是在1978年以前呢，这些人都没有参加这个乳房 X 光的筛检。那么在1978年以后呢，你可以看到绿色的，就是这些人呢，他都有参加这个乳房 X 光的筛检。所以这是一个大的，这个参与的程度呢，真的是有效的提高了控制这个乳癌的发病率。
Yeah, we can go to the next slide. So, and what we see is a very good adoption of mammograms in that county. And, I'm going to just focus on the top two graphs. The first graph just shows the incidence of breast cancer. And what we see is like a jump in the incidence of breast cancer detection or early on, and that is expected with the adoption of mammograms at that time. And then over time, the incidence of detected breast cancer on mammograms matches the natural incidence of breast cancer.
所以在上面的这个图呢，就是显示说，这个当然多做了这个乳房筛检的话，就会多发现一些这个乳癌的发病率。但是呢，继续这样做下来以后，这个两个值大概就是差不多了。
With the second graph, what you can see is a very clear decline in death of breast cancer in women who undergo their mammograms.
第二个图呢，你可以看出来，这个红色呢都是有得这个乳癌的人，那么深红色在后面，你可以看到它渐渐的降下来。意思就是说，如果有更多的人参加这个乳癌筛检的话，就早期发现、早期治疗，存活率就渐渐的变高，死亡率就渐渐减少。
So this is, not unexpected. If we can catch breast cancers earlier, they're smaller, they're at an earlier stage. And, at that point in time, they can be resected and the patients can be rendered cancer-free.
对，所以在越早发现呢，它越小，越小的时候越容易处理。所以当你处理了它以后，不管是开刀或者是做这个 radiation， 就容易说把它完全杀死，复发率就会比较减少。
And, as Dr. Coley had, showed us all before, breast cancer surgery really has come a long way from a very, morbid surgery to now something that, can leave patients with a barely any distinguishable features of having had a surgery.
那么刚才呢是这个外科医师跟我们讲解怎么样这个现在的方法不一样了，所以动过手术以后也不必觉得自卑，因为可以看起来跟原来可能差不多。
And if caught early, most of these women, the odds are already in their favor that their cancer has been removed and will not come back.
那如果早期发现的话，把它除掉了，它就不会再复发。
But unfortunately, as we're all aware that some women unfortunately do have their breast cancers return.
那当然还是有人他们会有一些复发的风险，所以呢，李医师在这边就要解释一下，到底是哪一些是它的风险。
Yeah. And the next step that a lot of patients will ask is, what can I do to keep the cancer from coming back?
那很多病人就会问说，那么我可以做什么事情，不要让这个肿瘤细胞再回来呢？
So there are a lot of different factors or features of the cancer that determine what modalities or what treatments we would offer or recommend to patients.
所以有很多不同的方法，我们可以推荐给病人，怎么样处理，怎么样治疗，而不让它再复发。
And right here on the slide, it's the size and lymph node involvement are probably the biggest risk factors in determining or the largest factors in determining what is the risk of cancer returning.
所以在这边头两项，一个是它的尺寸，一个是淋巴结。所以如果尺寸越大，还是转移的淋巴结越多，那么就越可能会复发。如果尺寸越小，然后没有转移到淋巴结，当然就不太可能复发。
Dr. Coley had mentioned, patients who had stage 1, these patients have almost a greater than 95% chance of being cured of their cancer. As we move to stage 3, they still have about an 80% chance of being cured. Other factors that, determine whether or not we want to use adjuvant chemo or adjuvant hormone therapy is histology. There are some, and histology is how a tumor looks under the microscope. And there are some histologies that are very good and that we don't have to offer chemotherapy, while others are more aggressive, and we would want to offer more treatments to lower their risk. Other features are Ki-67. We use that as it measures the rate of the cells dividing, and a higher number suggests that the cells are growing faster, and we tend to treat, or we now treat these cancers a little differently. Another important factor is the estrogen and progesterone receptor. If the breast cancer cells express the estrogen or progesterone receptor, it suggests that these cancer cells depend on estrogen as a stimulus for them to grow. So if we could block that receptor, we could decrease the breast cancer recurrence rates. There's also another test, Oncotype DX, where we look at 21 genes within a cell, and based on their expression patterns, we can get a score on the risk of recurrence as well. And it can range between 4 and 30%. And if the patients are at high risk, we tend to offer these patients chemotherapy as well. There's also the HER2 receptor. Sorry, there's a typo on the slide. And these patients, if they have elevated HER2 expression, we use targeted antibodies to attack these cells, which allows us to very effectively control these cancer cells.
所以，刚才有提到，譬如说发现是第1期或者是第4期。第1期的话，当然这个存活率就95%以上；第3期呢，至少也有80%以上。所以根据它的不同的期，然后也根据它的形态，我们可以决定说哪些人是需要用化疗，哪些人是需要用荷尔蒙的治疗。那么一个例子就是说，这边有提到的 Ki-67，这个是在量这个细胞的分化率。如果细胞它的分化很快的话，就是表示说它长得快。那这样子的时候呢，就应该要让他们用化疗阻止它。那么另外还有一种叫 激素受体。我们的身体里面呢有2种女性荷尔蒙，一个叫做 estrogen， 就是雌激素，然后另外一个叫做 progesterone， 是孕激素。那么如果他们是有这种激素，因为刚才你有看到有些它写是一个正号，那有这种激素的话呢，我们就要用一种药是可以阻止这个女性荷尔蒙的，那么就可以阻止细胞的分化，阻止的它复发。那另外还有一种是算这个oncotype， 就是我们身体里面的基因呢，可以拿来分析，然后有数据，通常可以查出从4%到30%的这个高危险群的话，那么就给他用化疗。那么另外还有一个叫做 Herceptin， 就是 HER， 常常如果说它测出来就是一个细胞，如果他们拿出来到病理室去查，它通常都可以分析出来。如果它有 Herceptin 的话，那也可以用另外一种药，这个药是一种抗体，直接来抵抗这个 Herceptin， 也可以让它阻止复发。
So we have, we have 3 main adjuvant therapies. We have hormone therapy, or really anti-estrogen therapies. Generally, they can reduce the risk of breast cancer by half. We have chemotherapy, which we generally offer to patients with higher stage patients with, and so they would have lymph node disease. Or now, if they don't have lymph nodes, but if they have a high oncotype DX score. And then we also offer radiation therapy for patients with very large tumors or tumors that are involved in the lymph nodes. And if patients opt for breast conservation therapy, we also offer whole breast radiation after their surgery.
所以除了手术把这个肿瘤除去以外，另外还有3种比较常用的辅助疗法。我们刚才有提过，一个是荷尔蒙疗法，就是把这个女性荷尔蒙让它阻止它的发展。那么有一种就是化疗，那么化疗的话，它如果是有转移到淋巴的话，多半要用化学治疗。另外还有就是放射线治疗，如果是一个很大的肿瘤，那么可能会先用放射线治疗把它缩小了以后，再用手术把它除掉。或者是如果是小的肿瘤，那么是要采取保留性的手术的话，那么就是把保留性的手术多半的这个乳房还是存留在那里，然后旁边呢就用放射性治疗，希望能够把肉眼看不到的还是这个显微镜看不到的一些癌症细胞都把它杀死。
We have different kinds of hormone therapies. We use tamoxifen in women who are premenopausal. We use medications, a class of medications called aromatase inhibitors for women who are postmenopausal, and they block the production of estrogen in women. And then a medication now, Verzenio, that we use in adjuvant therapy, which blocks the enzyme in the cell, the CDK4/6 enzyme. And we use these in patients with high-risk hormone positive breast cancers, and to further decrease the risk of recurrence.
那刚才有提到的第一个这个荷尔蒙的激素治疗法的话，通常如果说还没有到停经的比较年轻一点的妇女的话，我们是提供她 tamoxifen。如果是停经以后的妇女的话，提供她的是第2个叫 aromatase inhibitor。那么也有另外一种是让她一种酶，让她这一个新的药可以让身体不再制造出这个女性荷尔蒙 estrogen。
Here I've just listed some of the more common regimens that I use in my own practice. it by no means is an exhaustive list of all the different chemo regimens used, you know, in America or worldwide. But all of these regimens, you know, they all have their specific indications, I guess, and you know, based on a lot of the tumor characteristics and patient you know, other conditions that the patients may lead me to use one regimen over another.
在这边所看到的是化学治疗的一些药物，这个李医师常常在用的。那么要根据这个肿瘤的特性而选不同种的。譬如说在上面这些方案，它是有不同种的药。那么像第二个这个 HER2 的，就是说如果说这个人他的肿瘤呢发现他有这个这个是阳性的，那么就是用这些药。那么另外呢，第三个就是当他的女性荷尔蒙的这个受体跟他 HER2 的受体通通都没有的时候，那么就是用这个药。所以根据肿瘤的特性而选不同的药。
So another part of, you know, the breast cancer care after surgery is if women opt to have you know, breast conservation therapy, would be to continue to with their mammograms, looking for the development of, you know, new breast cancers.
那当然在诊断然后治疗以后，那么需要有监测的系统。这每6个月到每1年，还是照样要做 mammogram。那么有的人呢也需要做 ultrasound， 就是 B 超；有的人需要做 MRI。那么您的医生呢都会给你建议哪一个是合适的。
Yeah. And then another question. Oh, yeah, sorry. And then we can go back up or to the previous slide, and just after this one. And then another question that patients often ask is, you know, when do they do regular scans after their breast cancer surgery? And, you know, meaning, you know, when will I order a CAT scan of my whole body? And one thing I have to explain to these patients is for breast cancer, we don't routinely order scans of their whole body if they have no pains or no complaints. And the reasons for that are, unfortunately for breast cancer, there is no cutoff for when a breast cancer could recur. For most other cancers, they'll recur within 5 years. But for breast cancers, you know, occasionally we'll see someone have a recurrence of the breast cancer 10 or 14 or 15 years out. So for that reason, we couldn't just scan people indefinitely for the next 10 to 15 years. Just as a point of reference, a CAT scan of the whole body is generally about a year's worth of radiation that we would normally be exposed to just walking around on the earth. So if we were to scan a patient 3 to 4 times a year, the cumulative radiation adds up rather quickly. And then another reason, another reason that we don't scan is breast cancers, when they do recur, they are very responsive to treatment. And what we've learned is that whether we catch a cancer that is destined to recur on a scan or a few months later when someone notices a pain or a symptom, the patient's overall survival or ability to control the cancer is not affected.
所以常常有人问李医师说，那么做完手术以后，要多长要做哪些扫描？有的人要求要电脑断层扫描。 那么李医师是建议我们不需要做这个电脑断层扫描，因为你要做全身的电脑断层扫描的话，所接受的辐射量等于是你做1年的放射性治疗每天做的辐射量。那么其他的癌症的话，它要复发可能是在5年之内。那当然，乳癌它在复发的话，它有的时候很奇怪，它10年到15年以后才复发。所以如果说每1年都在做电层扫描，或者是1年做超过3次以上，那么身体上所接受的辐射量是非常大的。你也知道，如果接受的辐射量大，会引起别的部分有问题。那么还有一点值得安慰的就是说，即使是乳癌复发了，你发现说它对治疗的方法很有效，所以不管这个复发的乳癌是因为做这个扫描而发现的，还是说有人他摸到了硬块才发现，发现说最后的存活率是相似的，所以李医师不建议说，这个手术完还是治疗完以后不停的做扫描。
那应该多久做一次扫描呢？
请等一下，我们这是最后一章，我们讲完再说。Okay, please, Dr. Lee.
Oh, yeah. And just some other things that I wanted to mention, I guess that, regarding just our treatment of patients, at our hospital, we've been implementing the cold cap to help minimize hair loss during chemotherapy. I would say immunotherapy has been has made this past 5-7 years just very exciting in terms of what immunotherapy has been able to do in this field in not only breast cancer, but many other cancers. Patients are alive longer or being cured, potentially cured with their immunotherapies. And then finally, just, with the merger with Robert Wood Johnson, we've really been able to offer patients, the option or the opportunity to enroll in clinical trials here at Monmouth or in my private practice. Just in just breast cancer alone, we have 6 to 7 treatment trials, but over 30 different trials for other cancers that we are able to offer at here in Monmouth.
所以这个李医师还跟各位分享一下，我们现在有一些比较先进的疗法，譬如说，大家都知道，如果做这个化疗的话，可能会脱发，所以呢，现在会提供说，如果戴冷的帽子来治疗的话，会避免脱发。然后，另外，这个过去的这个10年来，那个免疫疗法的进步也很多，有很多人都被治愈了。那另外呢，因这个在最近几年，因为Barnabas 跟Robert Wood Johnson 合并，所以这个原来是在 New Jersey 的癌症中心 Cancer Institute of New Jersey 所进行的临床实验，现在呢都可以造福这个所有跟 Barnabas 有关的一些病人，所以李医师有很多的病人也都可以参加这个临床实验。以前是只有在 Cancer Institute New Jersey 的这个病人才能参加，所以现在呢，他的病人大概有参加6到7种不同的临床实验。那事实上，现在在研究的方面，至少有超过30种不同的临床实验。Okay, so we are going to take the question.
非常感谢2位医生哈，那我们现在呢可以到提问时间。我看到里面有第一个问题，其实有提到说，New Jersey 呢以前是cancer 发生率非常非常高的一个地方，不知道现在是否还是这样？那我们可能要请那个几位医生来帮我们说一下，看看是不是这样。 就是说Dr. Lee and Dr. Cody, there's some questions in the chat box. You can also open it and see it. The first one actually is asking for the news report that New Jersey actually has the highest cancer rate. This is still the current situation. Do you know the reason why cause it?
I'm not sure if New Jersey still has the highest rates. Certainly, I don't think we can really point to any one thing. What I can say is obviously, in terms of the Northeast, generally we have a lower death rate from cancer because of our screenings and, you know, I guess, access to medical care. But I'm not sure why, you know, any state, you know, at this time would have a higher rate, because I think it's multifactorial. A lot of different things go into cancers that I think is very difficult to tease out.
Yeah.
所以在现在来讲，很难说哪一个州会有比较高的这个癌症发率。在以前的话，譬如说 New Jersey 有一些城市，像 Toms River 啦，一些地方，他们的癌症发率会比较高。那个时候呢，大家是觉得说，可能跟以前 New Jersey 有一些 toxic waste site， 就是说有毒废弃物的，会影响到地下水有关系。但是现在的话，李医师的说法是，这是有很多不同的因素的，所以已经没有办法说是不是 New Jersey 还是很高的。
对，目前的话，可能李医生讲说有各种各样的原因哈，都会导致癌症的并发。最近这几年，尤其是那后面有一个病人，大家有在问哈，跟大家分享说，想问一下乳癌的患者的治疗，什么样的人需要做基因的检测？就是说Dr. Lee, Dr. Cody, there's a audience asking, it's for the cancer patient, who need to do like a genetic testing?
So the previous recommendations for genetic testing was if there was a very strong family history with multiple first-degree relatives. And then they started expanding this to testing patients who also were just particularly young at the age of diagnosis, and trying to find if that's the reason why someone so young is getting breast cancer. And the reason why it was only these select people that were getting it covered in the past was because genetic testing was once very expensive, very cost prohibitive. But now that there are many of these commercially available kits like 23andMe, Ancestry, the cost of genetic testing has come down so much, it's less than the cost of doing a diagnostic mammogram. And with that, we've now expanded the recommendations that anyone who has been diagnosed with breast cancer, whether they have a family history or not, and regardless of their age, is able to get genetic testing. And we are finding several more genes because we're testing more patients.
所以在以前的话是说，如果有家族史，或者是说很年轻就得病的话，那么会建议去做这个基因检测。但是呢，同时也跟这个保险公司是不是有付有关系。其实有的人他们有保险，但是常常都会警告他们说，哇，这个基因检测是要自己付款的。但是最近几年呢，因为有很多在外面的这个商业的这个基因检测也有了，我相信各位如果不是你们自己的话，你们的孩子们他们可能都在做这个 23andMe 啊什么这些东西呢，都很便宜，然后在网上就可以订。那也许做几个呢，还比这个去做 mammogram 还要便宜。所以呢，现在呢，只要有人他们想要做，都可以去做。
对，很多我们的病患哈，其实尤其是一个是说，先解释一下这个遗传基因测试，它都能测试到什么。那向上呢是查你父母那一辈给你带来的这个基因会造成什么样的结果， 那你根据这个检测的结果呢，来决定说你做什么样的流程，就是比如说放疗、化疗，你需要做什么样的检测，这是一个就是说基因检测来带给你的效果。另外一部分呢，就是说向下查对你的孩子、你的小孩能从你会遗传到什么，这是基因检测要做的2件事情哈。So we have another question. It's I think it's one of the patients that he's like he or she is 75 years old, and 2 years ago, and they found it's a stage 1 breast cancer, and I think it's a ER/PR both positive, and the HER2 is negative. So she actually did a mastectomy for the right breast. And right now she's using the medication, and she has I think it's a mom, sister, both has breast cancer. And she actually did a genetic test recently, and BRCA2 is positive. So this is like a mutation gene. So she's asking what she should do.
So with that genetic mutation, it certainly explains why she developed breast cancer, and she has that strong family history of breast cancer. If she had a mastectomy on one side and she still has the other side, she needs to either be screened very closely with that high risk type of imaging, mammogram and MRI, or she should consider preventative mastectomy, because that genetic mutation, it can lead to a 50% chance of getting breast cancer within the first 5 years of the diagnosis of the other one. So it's certainly a much higher risk of getting breast cancer with that gene, and it's one of the indications to do prophylactic or preventative mastectomy.
所以这位观众就是建议，就是说，因为如果你有这个 BRCA2 的突变基因的话，在5年之内，可能50%的机会会另外一个乳房会有乳癌，所以建议您考虑做预防性的乳房切除手术。
No, I mean, I just want to add that at 75, that's not always the right choice for everyone. And so you want to take into consideration the patient's health status and medical history. And at the very least, you can follow the patient closely if they're not interested in doing that prophylactic mastectomy. But, it's important to know that there is that increased risk with that gene.
Yeah, 我们刚才所提供的是说，如果你完全没有别的病，因为75岁的话，有的人可能也有高血压、糖尿病，各式各样的不同的病，所以这个时候也得考虑说，是不是合适做这个乳房全部切除的手术。那如果不做的话也没有关系，就是要更小心的来做筛检，譬如说 mammogram、MRI， 也许要做的更频繁一点。但是呢，只是要记住，如果这个 BRCA2 的 gene 是阳性的话，那么这个复发率是很高的。
哦，谢谢医生。医生，那么我还有一个问题，就是说跟乳勺有关吗？
是和什么有关？
跟乳勺有关吗？
什么是乳勺？
跟卵巢。
跟卵巢有没有关系 ？OK，
有的时候通常也要小心，就是说这些反正是跟女性荷尔蒙有关联的器官都要小心。
会不会要把卵巢也割掉？
如果是 BRCA2 gene 的话，我想请您跟您的医生商量看看。而且
yeah.
So Dr. Coley, this patient was asking that should she also remove ovaries?
There's also that increased risk of ovarian cancer. Absolutely. And unlike breast cancer, we don't have very good screening tools for ovarian cancer. So it's worth considering. Absolutely.
所以您是应该要考虑，因为我们到现在为止没有很好的方法来筛检这个卵巢癌。我们有这个子宫抹片检查可以检查出子宫颈癌，我们有这个 mammogram 可以检查出乳癌，可是一直都没有好方法可以检查出卵巢癌。所以呢，建议是说考虑把它拿掉，因为它们都是跟女性荷尔蒙有关系的。
那有没有这方面的病人，他得了，因为是基因的问题，他那个又复发又是卵巢？
当然有啊，这个东西，而且这个基因有的时候我的病人里面不只是女方，他们通常如果说有一个人 BRCA 得了的话，男生女生每个人都去查，因为他的兄弟也可能有，所以都要去查的。那么下面还有一个就是说75岁以上是不是可以每2年才做一次 mammogram？ So what do you think, Dr. Coley, if they are over the age of 75 and ask if they can just do mammogram every 2 years instead of every year?
Well, it's better than not at all. But like I said, if the patient is healthy and we would act upon the result, then I think it should be done every year. And, age is a number, not a functional status. So not all 75-year-olds are the same. So imaging plans and medical treatments need to really be individualized for each person. So it's hard to give a blanket statement, but I think there's a lot of benefit to doing the imaging. There's little downside.
所以如果你愿意每2年才去做一次，总比完全不做好。那当然，我们的建议是1年1次。那如果说这个你觉得每次去做很痛很不舒服的话，我常常建议我的病人说，你吃个 Tylenol 再去吧，因为压起来是很不舒服。
我有个问题想问一下 Dr. Lee 哈，刚刚呢，因为也都答了一些其他的问题，就是因为我现在呢，我们华人医疗服务部目前帮助的肿瘤科的病人其实非常多。那就是不管在我们现在有5个 location 嘛，所以在不同的地点都有这些就是癌症病患。那我想问2个问题，一个是说这些caregiver 哈，家庭里面的这个 support， 不知道那个 Dr. Lee 有没有什么suggestion， 就是尤其是刚刚diagnosis cancer 的。So Dr. Lee, I actually have a question for our patient because the Chinese medical program actually navigates so many cancer patients, which is doing chemo radiation right now after the surgery, and they also have other type of surgery. Cancer. So any suggestion you can give it to the caregiver, not just the patients. So sometimes they are so anxious that they asking so many different questions all the time. So is there any any question, any suggestion you can give it to them?
For the caregiver, for
family members,
for family members with cancer.
They always asking for suggestions, but Chinese tradition sometimes is like you can eat this and that, and something you cannot eat, and sometimes you cannot even do so many exercise. So what our suggestion from a professional medical oncologist?
Generally, I would, offer what your primary care would say, eat a healthy diet, exercise, and, I think a lot of times people, what I tell a lot of patients is, you should just live your life. But I think overall that will lead to better health, and try not to worry about things. We're doing everything that we can, in terms of our medicines to reduce the risk. So I always tell the patients, you've done everything, or you're doing everything that you can to keep the risks down, and, to just continue to exercise and just be healthy. I don't know if that helps.
所以有人在问说应该要吃什么样的东西，这个呢有一点很重要的就是说你还是应该要有营养。 在很多年前呢，有一种说法是说，都不要吃啊，要把这个癌症细胞给饿死。可是你把癌症细胞饿死的时候，你自己的好细胞也饿死了，所以千万不要走那条路。那么至于说有些东西我们知道是吃了的话对细胞好，譬如说如果很喜欢吃很甜的东西，那在一般来讲都是会让这个细胞发炎的。那至于说中国人呢比较注重食补，而不注重不想要吃药，所以 Dr. Lee 的说法就是说，你继续做你的运动，你继续保持你的营养，因为生活还是要过下去。那么现在呢，得过乳癌的人有很多存活的，我们刚刚有讲过380万的人，很多的。
I did want to add one thing to I guess the question with the BRCA too. What I will want to add that the BRCA mutation raises the risk for all cancers. So we do focus a lot on the mastectomy or breast cancer and ovarian cancers because it does raise the risk of those cancers so high that we want to do surgery to kind of reduce the risk. But all colon cancer also increases, prostate cancer. So I would also stress the importance of genetic testing for other family members in Wang Ming's family, and also to just really keep up with all breast cancer screenings if you do have the BRCA mutation. So even if you get the mastectomy, bilateral, removing both ovaries and the uterus, you still need to focus on other cancer screenings as well.
所以 Dr. Lee 要提醒各位，就是说有这个 BRCA gene 的人呢，不只是要担心这个乳癌跟这个卵巢癌，通常呢也发现说大肠癌还是攝護腺癌都有增加的可能性。因此家里面只要有一个人这个 BRCA gene 是阳性的话，最好大家都去做检查，像我刚刚说的，不管是男生还是女生。
我们也有男性的乳癌病人哈，I just mentioned we do have a male breast cancer patients, so everybody need to take care. So 就算是男性哈，我们也有检测出来的，尤其是在乳腺的腋下的部分，还是要引起注意的哈。
So to two doctors, there's a question and say, is a breast cancer caused by genetic issue, the survival rate is lower than the one who doesn't have the genetic issue? And the second question is, if someone diagnosed the breast cancer younger, would that means that the survival rate is lower than the older patients?
I think I can take this one. I think it is still driven mainly by stage. So if it's caught early and resected, the aggressiveness doesn't, I guess, maybe doesn't matter so much, or if it was related to, I guess, like a cancer gene. But those patients would still be at higher risk for new cancers. So they could still get new ones, but if we catch any cancer and we resect it, they should do the same as a similar stage patient without a genetic risk factor.
And Dr. Coley, do you have any to add?
I think, when someone is diagnosed with breast cancer at a very young age, it's not uncommon for those to be a more aggressive type of breast cancer too. So, I mean, especially for someone who's under 40, where they're not even yet getting the screening imaging, they likely are feeling it as a lump or something abnormal, and then they're getting diagnosed at a later stage because of that. So, it's not a, hard and fast rule that the younger ones are always going to have the more aggressive ones, but, we do see less aggressive cancers in the older patients and more aggressive cancers in the younger patients, and certain ethnicities also.
所以，总结的来说，当然，如果发现的时候是比较早期的，那么存活率就会比较高，倒不一定说是，如果你是在老一点的时候发现，但是是比较早期的，那也没有关系。那另外一个来说法的话，当然通常我们的很多的保险公司就是40岁以上才开始付这个做 mammogram 的钱。那么所以呢，如果说这个人40岁以上的人比较少人去做 mammogram， 那么他自己摸到了肿瘤，然后去做的时候，可能所发现的这个乳癌呢是比较激进性的，叫做 aggressive。那所以呢，可能发现的时候也是比较严重，所以呢，而且这个跟是哪一个种族也有关系白人、黑人、黄种人什么也都有不同的关系，所以没有办法说以一概全。那总的来说呢，就是说有机会有这个。应该每一年可以去做这个 mammogram 的话，还是去做比较好。
我不知道后面还有几个问题哈，没有特别多。有一位high school student 可能想要做 volunteer， 这个以后你们可以联络我们哈。我可不可以请我的同事把华人医疗服务部的联络方式，包括我们的 email 发到chat box 里，这样的话大家知道。那我看到我知道Dr. Wolfson is also online and he actually reached out to us and asking for something as like a face related diagnosis, facial scanning. But I don't know. Can Dr. Cody and Dr. Lee answer about that question? It's
about facial imaging.
Facial imaging scanning. Yeah.
I think it sounds very interesting, but I don't know of any data that supports that type of technology. And it's not the only thing that's controversial as far as imaging. You know, we've tried over the years to find different ways to detect cancer. One of the more famous ones was thermography, where you were looking at heat sensing technology. And the thought was similar to like a PET scan. When patients have cancer, it's more metabolically active. And so they would assume that it would be producing heat. And that's why thermography was proposed as something for breast imaging, to find breast cancer. But the American Society of Breast Surgeons did a study looking at patients with a known biopsy-proven breast cancer, and thermography missed 75% of them. So, you know, we're always trying new things to see if there's alternatives to what we're doing now. And I don't know about the facial imaging, and it may be something promising in the future, but I don't know enough about it at this point.
Okay, there's a question about clarifying after the surgery, too much radiation. What Dr. Lee meant was the total body CAT scan. 所以刚才我们讲的就是说是，如果是要做全身的电脑断层扫描，那么那样子的话是会有很多的辐射线，但是如果1年做一次的 mammogram， 这个辐射线是非常少的。
我看到就是 Lily 有在举手，不知道你有没有什么问题没有发在那个 chat box 里的话，可以 unmute 再问一下好吗？
Oh yeah, I have a question. So, since fat cells produce hormones like estrogen, does eating animal fat and meat increase the risk of breast cancer?
I'm not sure. I think there's some data that in terms of like eating red meat and, you know, colon cancers or GI cancers, and maybe also high fat diets. I think just generally by themselves, whether you eat meat or fat, I I don't think if you're just eating it by itself, it is bad. It's your own fat cells that are making the estrogen. So if you, there is a correlation between patients who are more obese and having higher estrogen levels, so they tend to have a slightly higher chance of a breast cancer coming back. But I think as long as you can eat it, as long as you maintain a healthy weight, is probably how I would answer your question.
所以是有这个有的人如果是比较肥胖的话，那么他的这个乳癌的复发率可能会高一点点，因为我们都知道这个肥胖的细胞里面含有 estrogen， 就是女性荷尔蒙。但是如果你说只是吃肉，会不会增加那个？那倒不一定。现在的研究是知道说吃红肉的话是会增加大肠癌。如果只吃红肉，是不是会增加乳癌？倒没有人专门在研究这个。当然，所有的东西吃东西来讲，什么东西都是适量比较好。
Second question is, recently on my mammogram, they found I have a calcification and it's category 3. How is that compared to category 1 and 2? How is it determined, the category 1, 2, and 3?
So the radiologists have to grade their findings based on a scale of suspicion. And when there's something new on imaging, even if it looks very benign, they do want to track it to ensure that there's stability over time. And with calcifications, not all calcifications mean cancer. You can have calcifications from an old cyst, from blood vessels, atherosclerosis, trauma to the breast. But, so you can see a calcification that may look benign, but if you don't follow it, you may miss further development that could be concerning. So if you have 6-month follow-up imaging and then there's more calcifications and they're grouped or in a certain pattern, that may indicate need for a biopsy. But in general, for a radiologist to call something BI-RADS 3, they have to be very confident that it's not a malignancy. And that's basically a safety net that they want to have you come back in 6 months.
所以这个如果你这个乳房的X 光显示说你有钙化现象，并不是所有的钙化现象都是表示说有乳癌。那么譬如说有的人他在年轻的时候做运动撞到了，受伤了，或者是说你曾经有把这个良性的一种囊肿除出来，都有可能有钙化的现象。主要的就是说，在放射线科医师呢，他会把它归类到1、2、3、4、5项。他通常给你第3项，意思就是说每6个月来再查一次，确定说这个不会转坏。那么与其说1年1次。所以而且有的时候我们在读这个报告的时候，它钙化现象它会有一些形容词，它会讲说都是分散开来的钙化现象，或者是集中在一起的钙化现象。所以这个都是并不是说只要有钙化现象就是有肿瘤，所以只是说要更更加的小心来追踪。
对，我们现在呢已经马上快9点钟了哈，所以呢非常感谢2位医生给我们2 hours. So really appreciate Dr. Coley and Dr. Lee spending so long time today with the webinar, because we also need to do translation. So it's last longer than our regular webinar. So really appreciate. I don't know is there any other questions, but in the future you can also reach out to us. I think my coworker actually posted our information in the chat box. So if you have a more question, you can reach out to us and we can pass the information and question to the doctors. And really also thank you for Dr. Lin is so patient. It's even with all the technology, the tech issue today. So 真的非常感谢大家哈，也都是一直待到这么晚。 因为今天呢会不大一样，会有translation 呢，也会有更多的时间。那如果大家其后有什么的question 的话呢，也可以发给我们，我们的 email、电话还有我们网址上都有登录出来，都有 post 出来哈。那我们的webinar 呢，到时候也会有video link 会发给大家。那今天的讲座呢，如果你有错过一些，或者说你想 review 啊，你都可以通过这个链接呢去看今天的讲座。那上面呢也有其他我们过去 pandemic 2年做的所有的 webinars 都在上面哈，你们都可以看的。那我们真的是要谢谢一下Dr. Coley、Dr. Lee 还有 Dr. Lin 哈，今天给我们带来这么精彩的讲座。那后面如果有什么问题的话呢，还可以跟我们联系，好不好？
所以你们如果把问题都发来的话，他们可以集中起来，然后再送给2位医师，在那边解答。
对，我们今天的讲座呢，我们也会有一个总结性的新闻，会在 local 的 newspaper 上会发表出来，大家可以看我们的Global Times Chinese newspaper 上面有我们的专栏，会把今天的讲座呢都 post 出来。那我们也会在其他的一些报章上，像Sino Monthly 呀、World Journal， 包括其他的我们都有。那大家可以来就看我们今天讲座的一个总结，不要担心哈。Thank you so much, Dr. Coley and Dr. Lee. Thank you for your time. It's like 2 hours. Really appreciate your help.
Thank you so much for
Thank you.
having me. This was a very engaged audience and great turnout. So I'm really happy to be a part of this. Thank you so much.
Thank you. Thank
Thank
you
you,
all.
doctors.
Thank you for all doctors and organizer. Yeah,
Thank you,
Thank you.
doctors.
All right.
great seminar.
Thank
Thank
you.
you. Yeah.
Thank you,
Good
Stephanie.
night.
Bye.
Good night.
Great night. Thank you so much for
Bye.
joining
Thank
us.
you.
Good night.
Bye.
Sure.
Bye. Bye bye.
我们正式看一下这里，因为2个没有正式照例。
等一下。
等一下。